Thanks, Aaron. That was a great talk. And you've now heard 3 superb talks. I'm sure you have some questions about many of them, and we'll get to those shortly. But I would like to introduce now Stephanie Lerner, who I have known for a long, long time. And she is going to give her view of the patient experience with polyposis.
So anyway, good evening, and I just want to thank you in advance for letting me speak this evening. Anyway, back on January the 4th of this year, at the age of 62, I celebrated a very special anniversary. I had lived as long with an ileostomy as I had lived without. January the 4th, 1986 is when I had surgery because of FAP. Until then, I knew nothing about this hereditary disease. The surgery saved my life, and I have accomplished so much since. My story starts actually 2 years earlier in 1983. At the age of 28, I was married and had 2 children. My son Daniel was 3 years old, and my daughter Rachel was just 1. I felt a lump just below my waist. My family doctor assured me it was nothing and sent me to a surgeon. Surgery was scheduled for Christmas 1983, when family from England could come and help look after the children. I had a desmoid tumor removed from my stomach muscle and a 6-inch piece of mesh put in. I asked why I had it and was told that some women get them during pregnancy. At the time, I did not think to question it. And while in hospital, my 14-month-old daughter thought it was very funny to be able to walk faster than me while holding onto her IV pole. Starting around October 1985, I had health problems, which I ignored. December the 24th, I saw my family doctor, and I told him I thought I was anemic and I might have a hemorrhoid. After asking some questions, he said he would like to do a sigmoscope. While I got dressed, unbeknown to me, he called my husband at work and told him to come and take me straight to the hospital. I wasn't to drive. We did a detour on the way to the hospital to drop our children off at a friend's house. A long time later, when I had learnt about FAP, I realized how rare it was for a family doctor to see someone with so many polyps. I was admitted into hospital and hooked up for a blood transfusion. That took 2 days because I had lost so much blood. The surgeon I had seen 2 years earlier came to see me. He told me I had cancer, and the surgery he planned would be to give me a pelvic pouch. I really didn't know what he was talking about. I called my husband crying, and he rushed over to the hospital. The time he arrived, we found out the doctor had left for his Christmas vacation, and there was no one to answer any of our questions. We contacted people we knew to find out who we could go to for a second opinion. 3 names were suggested at the time. So early on the morning of January the 2nd, 1986, my husband called one of the doctors. The receptionist wasn't in yet, and the doctor answered the phone himself, something he had never done before. Hearing my story, he said he needed to see me. I left one hospital on a day pass to go to another here at Mount Sinai. The doctor, after examining me, explained why it was pointless for me to have the pelvic pouch procedure. My cancer had spread to the rectum, and as a surgeon would need to leave part of the rectum to do the procedure, there was a good chance it would all have to be reversed in a few years. I discharged myself from the first hospital and was admitted here to Mount Sinai. 2 days later, I had surgery to have my colon and rectum removed and be given a permanent ileostomy. One of the other doctors that had been recommended to me also helped in my surgery. During the surgery, the 2 doctors saw a large tumor on my liver and said there was a good chance it was malignant. They didn't tell me, but they did tell my husband. If it was malignant, it was thought I might have 9 months to live if I didn't have chemo. My husband called my family in England, and a day after my surgery, my parents arrived. A few days later, the doctor and my parents came in with my husband to tell me about my tumor. Their plan was for me, Daniel and Rachel to fly back to England and see about me having chemo there while family looked after the kids. I told everybody that the tumor might be there, but it wasn't malignant. I didn't look jaundiced, and everybody was telling me how quick I was recovering from my surgery, which wasn't possible if I had liver cancer. I was referred to a liver specialist here at Mount Sinai. He wasn't able to do a biopsy as the desmoid tumor was so hard it broke the needle. After some other tests, surgery was scheduled to remove the tumor along with 3/4 of my liver. That surgery went very well, but a day later I ended up with peritonitis. I was rushed back into the OR for emergency surgery. My husband was told I might not survive the night. As you can see, I did. And 3 months after being admitted into hospital, I discharged myself on March the 30th, my husband's birthday. When I went into hospital, he had a full head of hair. In those 3 months, he lost most of it. I left hospital with 3 drains that were still discharging bile from an area in my liver. After a time, 2 were removed, and I was left with 1 drain. A year later, just when more surgery was planned, the area dried up. In that year, we did go to Florida for a week with the kids. To make sure no sand got near the drains, every day I covered the area with waterproof tape and a square cut from a diaper. The day before my colon surgery, on January the 4th, I was given a booklet about familial polyposis. It did mention that some people with FAP also developed desmoid tumors. Because of all that had happened, it wasn't until I was recovering from the 3rd surgery that I started to question the fact I had a desmoid tumor removed 2 years earlier. I knew from the pathology report that the polyps I had in my colon were more than 2 years old. I found out desmoids develop in 3 ways: on old scar tissue, from pregnancy, and from FAP. In 1983, when the desmoid was found, I hadn't had any surgery, and being a woman, the surgeon had presumed it was because of my pregnancy a year earlier, and therefore didn't scope me. If he had, he would have seen all the polyps before they went malignant. I could have had elective surgery rather than emergency surgery. After my recovery in 1986, I advocated to have medical students taught that all women who are diagnosed with a desmoid tumor, even if there is no family history of FAP, they should be scoped. I do believe that if it had been my husband who had been diagnosed with a desmoid tumor, they would have scoped him, as they couldn't put it down to pregnancy and he'd had no surgery. My son Daniel was in kindergarten back in '86, and as many of you know or remember, they do a lot of show and tell in kindergarten. He wanted to explain to the class that I had a new poo bag. I talked to the teacher in advance so that she would know he would be bringing in a flange and a pouch. Daniel explained to his class that my poo bag inside me was broken, and so I now would be wearing a pouch on the outside. It was very important to my husband and I
Attention all visitors, attention all visitors. Visiting hours have now ended and you are requested to please leave immediately. Attention all visitors, attention all visitors. Visiting hours have now ended and you are requested to please leave immediately. Thank you and good night.
Anyway, it was very important to my husband and I that Daniel and Rachel knew you could lead a normal life with FAP. So we didn't know that they would, because we didn't know if they were going to inherit it. Being diagnosed with familial polyposis at the time was very confusing. I found out it didn't skip a generation, and children have a 50% chance of inheriting the disease. At the time, my parents, both in their middle 60s, were very healthy. No one in my family had heard of familial polyposis or knew of a family member having cancer. It seemed I was the first to have the disease. At the time, my parents, sister and brother, who all lived in England, it was suggested that they have a colonoscopy done. My brother and sister both went, and they were told they were fine. My mother cancelled her appointment at the last minute due to a cold and never did go. My father never wanted to go. I think he was afraid that they would tell him that he had passed it to me, his baby. Doctors here told me that he probably didn't have FAP, as it would have shown up by then. My brother started to go every year for a colonoscopy. He had 3 children and wanted to know that he was clear and therefore his children were clear of the disease. My sister only went the once. In 1993, I was told that researchers could, through DNA tests, let us know which family members carried the gene for FAP. So, of course, without hesitating, my husband and I agreed, and we phoned my family in England. blood was taken from me, my husband, and our 2 children. And in England, my parents, brother, and sister gave blood samples, which were then sent to Toronto. This was all worked out through Terry Burke, who many of you, of course, know. She ended up carrying the blood samples back to Canada with her after a business trip to London. In my mind, I thought if I was the first, I could also be the last. My children could have their father's genes. The results came back in July. All my family in England were fine. Daniel and Rachel, they had both inherited familial polyposis from me. My husband and I felt it was important to get the kids into a habit of going once a year for a colonoscopy, and the same way they go to a dentist regularly. I learned that I was what they called a spontaneous mutation, someone who was the first of a familial disease. In November '93, both Daniel and Rachel had colonoscopies done at the Hospital for Sick Children. Both had polyps, but Daniel's were getting big. He would need surgery in the next few years. In 1994, after Rachel turned 12, I was able to have my children transferred through to Mount Sinai so we could all be under the care of Dr. Cohen. In November of that year, they had another colonoscopy done here at Mount Sinai. They both came out of the procedure with a color picture of the inside of their colons. They both thought they were, quote, neat and cool. For my husband and I, it showed how bad our son was compared to our daughter. Daniel had elective surgery on April the 2nd, '95. We were able to plan his surgery with him, the doctors, and his teachers at school. The teachers had advised us to have the surgery while he was in grade 10, which is what we did. Rachel's surgery was not planned so far in advance, but it was still elective and not an emergency like mine. She started going every 6 months for colonoscopies as the polyps had started to grow big in size and number. On January the 4th of '96, the 10th anniversary of my first operation, I was asked into the procedure room to see the monitor how bad Rachel's polyps had become. I was told she could not leave them any longer, and so Rachel had her surgery 4 weeks after her brother at the end of April '96. Both now had a pelvic pouch and both are doing very well. I can tell you it wasn't easy at the time of their surgeries. While they had temporary ileostomies, I couldn't keep Rachel hydrated or stop Daniel from having blockages. They were both admitted into hospital via emergency, and being different sexes put in different rooms. Dr. Cohen went to the hospital board and he got them to agree to let brother and sister be in the same room. While on an IV, they were both great, but couldn't stay in hospital until their reversal surgeries. So we were set up with IV poles at home. The kids would go to school and I would hook them up when they came home. There are a lot of stories related to that time, which I can tell later if anyone is interested. I will say for both of them, now in their 30s, having elective surgery has allowed them to have a happy, healthy life. The summer after Daniel's surgery, he went to Israel for 6 weeks. While there, he did a week of army training. It turned out to be the only kid who didn't dehydrate. While at university, Daniel went skydiving, competed in fencing, and took up rock climbing. Over the years, he supervised rope courses at summer camps, including Camp Trillium. Daniel lives in Toronto and is here with me this evening. Rachel is married and the mother of a 5-year-old and a 3-year-old. She and her family live in the States. Before becoming pregnant, Rachel discussed with her gynecologist the fact that she had a pelvic pouch. She was told she could not go into labor, so she had planned cesareans with both her deliveries. It took me a long time to get over the guilt of passing the disease to my children, and now I worry about whether my grandchildren have inherited it. 2 years ago, I came to the first FAP information evening, and I found it so informative. I also realized some of the problems I've had over the years have been minor compared to some of you, and I think all of you are quite remarkable. For years, I have had a digestive problem that we all thought was connected to a desmoid tumor I've had since '93, but it's turned out that the old scar tissue has been causing the problem. I would like to mention one small problem that I lived with for 2 years, as it just might help one of you or someone that you know. About 10 years ago, I became obsessed that I had a pouch odor. I couldn't work out what was causing it. I saw my family doctor, the local ET nurse, and several other doctors, including Dr. Silverberg here at Mount Sinai. He arranged for cultures to be taken from my intestine, which all came back normal. I was in tears of frustration, and I didn't know what to do or have let anybody be near me. I called Comfortex, whose ostomy supplies I use, and asked if they had changed any of their products. The customer service rep asked if I took any supplement pills. 2 years earlier, my personal trainer told me to take omega-3 pills. The Convatec rep said she had heard they can cause a problem. So within 2 days of stopping the pills, I have never had a problem again. So be careful of what supplement pills you take. Anyway, I'd like to thank Kara, Dr. Cohen, and everybody else on the team for asking me to speak. You remember all those times going to the board twice.
That was very heartwarming, and also I have to say that it demonstrates to me, and I'm sure to all of you, what a very positive attitude can do to help yourself and not necessarily rely on physicians and surgeons to tell you what to do. And I think that it really highlights what we've been trying to say today, that patients know themselves, and patients are able to make decisions, and they are able to go forward and have voices to be heard, and I think all those things are very important. These are things that just make common sense, and you would think that we should all have been doing this 50